I am bringing to you is something that is very near and dear to my heart. And this is because I personally have suffered with bladder pain syndrome myself for over a decade. Now, I'm going to talk to you about something that it took me about 6 or so years of academics combined with my own healing experiences, and now working with countless number of other of my own clients on what some of the root causes of bladder pain are. IC Healer is an organization that was created after my 10-year battle with IC and bladder pain syndrome. I was diagnosed around 2008, shortly after the birth of my first child. Now, I wasn't given many solutions outside of the conventional treatments, and so I decided not to do any of them. However, my symptoms continued to deteriorate, and this battle is what pushed me to seek on my own what my root cause was. And by seeking alternative care and self-research through my journey, I learned about my root cause and how the condition started for me. I also educated myself on the function of the human body and how everything is truly interconnected. This experience is what inspired me to enroll in a doctorate program and obtain 3 nutrition and functional wellness certifications. So what started with my struggles with my own healing journey turned to a strong passion to find answers to those struggling with the very same bladder condition that I'm afflicted with. But today I'm going to let you in on a big secret that even conventional medicine may be keeping from you, and that is your body has the innate ability to heal. We are born with this ability, and the job of practitioners like myself is to figure out how to harness this innate ability that we were given from birth. But I want to repeat this because it's really important to understand. The body has the innate ability to heal. And it's more than a belief. There's actually evidence that this is a true statement. So if your body can get worse, it can also get better. Your condition is not permanent. And here's something I think it's really important for you to know. When you identify your root cause, you can find healing opportunities. It's really that simple, though the process is not always easy. Your healing timeline and path are unique to you, and they depend on many factors. So why did I turn to functional medicine to heal my bladder? Well, conventional medicine failed me, but I don't want it to fail you. Literally millions of people every day struggle with this debilitating condition, and they're not giving many answers that this can be reversed. They don't even bother talking about it. They don't believe your environment can play into it. And more importantly, not many people really talk about what you can do to reverse this condition. What is only offered is medications to mask the symptoms. And that's not what I wanted. I wanted healing. And most importantly, I want you to understand that this is not your fault. It's not your fault you don't know this information, and it's not your fault you have this condition. It's just that doctors are not talking to you about this. So let's dive into the main topic today, and I'll get into some of the root causes of IC, but there will be a little bit of biology in this, so hang tight. I will also promise to get into some of the testing you can do to help identify your root cause towards the end. So over the last decade, I've really been fascinated with the different triggers of bladder pain syndrome and IC. And as you know, IC is a collection of symptoms such as urinary burning, urgency, frequency, bladder pressure, pain, vulvar pain, chronic UTIs, and pelvic pain. Your symptoms are your body's way of telling you that it needs help. So through my journey, I identified 8 root causes of IC and bladder pain syndrome. And this is the foundation of what I use as my investigation blueprints that we identify through health history and lab testing. No 2 people with this condition have the same root cause. Our job is to help you identify your unique root cause. So these causes include inflammation, gut imbalances, trauma, infections, genetics, toxins, food intolerances, and nutrient deficiencies. As you can see in this chart, under each main category, there are subcategories. And the key take-home point is everyone has their unique triggers. One person could have fungal overgrowth, whereas another may have Clostridia, and another may have mold or mycotoxins, and another may have all of them, as myself. No 2 people have the same root causes, but what we know is the causes are often cumulative. It's rare to see one person with just one problem and all of a sudden develop the syndrome. It takes years to manifest and often includes multiple triggers. It's not rare, though, to see someone who's got gut dysbiosis, which is imbalanced bacteria, moldy yeast overgrowth, an oxalate issue, vitamin and mineral deficiencies, bile insufficiencies, fat malabsorption, low gut immune markers, leaky gut, history of stress and trauma, poor diet, and a lack of exercise, and a bunch of genetic polymorphisms or variations that impair the detox pathway all in one person, which just creates that perfect storm. There's really not one smoking gun when it comes to the root cause. However, out of all of these root causes, there's one area that seems to be the captain of the ship. Can you guess which one it is? If you said gut, you got it right. It's the gut. So I want to dive a bit in this next few slides on how the gut is so involved in the pathogenesis and progression of bladder pain. You may be asking yourself how an organ distal from the bladder is such a big player. Well, I'll explain that soon in the next slides. So the next few slides are going to get a little bit of science, so please hang in there. I try to make it simple and it'll all make sense at the end. Leaky gut has become a buzzword lately. I think everyone uses it now in the functional medicine world. But before I explain the link to leaky gut and IC, let me first do a quick physiology lesson. Here is an image of the gut lining and these beautiful finger-like projections. This is highly magnified. We'll hang for a moment and I'll explain why they're so important. Your body is lined with mucous membranes, and in fact, they're all made of very similar tissue structure. The basic function is to act as the first defense against invaders. The mucous membrane lines your body cavities and canals and can lead to the outside. So these include like the respiratory tract, the digestive tract, and the urogenital tracts. These include your mouth, your nose, your trachea, lungs, intestines, urethra, bladder, and vagina. Now, mucous membranes and the mucus they secrete serve primarily in protection, but also in lubrication. For example, particulate matter and pathogens can become trapped in this mucus that's secreted to prevent their entry deeper into the tissue. And we see this, like, for example, in the lungs, for example, or tissues lying immediately beneath the membrane layer. The membranes and mucus just help protect, but they help keep the underlying tissues also moist for that purpose. The digestive system is a group of organs working together to convert food energy that you eat and the basic nutrients to feed the entire body. So food passes through a long tube inside the body known as the gastrointestinal tract, GI tract. And the GI tract is made up of the oral cavity, the pharynx, esophagus, stomach, small intestine, and large intestines. The digestive tract is actually pretty complex. It has a physical, biochemical, and immunological element to it. Physically, it consists of a mucus layer that separates the external from the internal environment. The intestinal epithelial layer, so it's called, is just the layer of cells that lines the intestines and acts to protect as a protective barrier, but also has selective uptake of materials into your body, like the food you eat and the nutrients. Now, this layer consists of the microbiota, which is bacteria. Often you might have heard the word probiotics, and that is the commensal community that inhabits the gut and are part of this system as well. They play a very important role in many functions, and this includes digestion, your immune system, neurological function, hormones, to name a few. Now, biochemically, your gut produces materials such as bile acids for breaking down fats, stomach acid to kill microorganisms, but also helps with protein, breaking down protein, and other elements such as defensins and lysozymes. The immunological components include antimicrobial peptides that kill bacteria and fungus, and secretory IgA that plays a big role in gut immunity. I'm going to talk more about that because it's really important, and various other cells that underlie this epithelium. So as you can see, the gut is a big boy in your body. So as a doctor in clinical nutrition, I cannot overlook a vital yet often overlooked function of your gut, and that's digestion. To achieve the goal of providing energy and nutrients to your body, there are 6 major functions that take place in the digestive system. These include ingestion. This is the process of eating, as we all know too well. However, sometimes we eat things that our body perceives as harmful, such as, imagine someone who gets food poisoning, or it may be someone who has celiac who eats bread or gluten containing foods, and it can cause problems. This is all due to many different factors. Bottom line, it all starts with what you put in your mouth, and what we choose to put in our mouth is really important. Then there's digestion. This involves the mouth, the teeth, the salivary glands, and the tongue. A lot of people don't realize that digestion actually begins in the mouth with enzymes that you have in your mouth to digest food. Secretion. Now, this is ongoing. Every day, the walls of the digestive tract secrete 7 quarts of water, acid buffers, and enzymes into the interior of the digestive tract. These secretions help maintain the pH. They help lubricate things to keep things moving, and they trigger the release of very important digestive enzymes. Drinking enough water is really important for this process, and a lot of people I work with are chronically dehydrated. But also maintaining our minerals such as sodium and potassium are also important because they regulate the fluid. Next is mixing and movements. These are muscular functions, and one is known as peristalsis, and it's the act of smooth muscles through the digestive tract that contract and then relax. So imagine after you swallow your food, it is acidified, liquefied, neutralized, homogenized, and then broken down into little particles for use. This entire process is involuntary, so you have no control over it. Then there's absorption that occurs when digested food molecules are taken through the epithelial lining of the small intestine, very important organ, into the bloodstream through the portal vein into the liver where they are filtered. For the bloodstream is where they pass onto the cells. However, if the gut is inflamed, which is often seen in leaky gut, there can be malabsorption that leads to nutrient deficiencies. And then the final step is excretion, and we excrete waste by having bowel movements known as poop. And these wastes consist of indigestible food components, waste products, bacteria, cells from the mucous lining being sloughed off, and food that has not yet been absorbed. Next up is a short discussion of the small intestine. And the reason I want to focus on this is because this is where most of the absorption of nutrients occurs. And the majority of the clients have a dysfunction in this organ, such as malabsorption disorder, celiac, leaky gut, and SIBO, to name a few. Now, the small intestine is really not small. It's about 15 to 20 feet long, and here's where food is completely digested and absorbed. Nutrients are absorbed through hundreds of small finger-like folds, like the projections I showed you in the other photo, called villi, which are covered by millions of microvilli. And they perform many important functions, especially producing digestive enzymes, absorbing nutrients, blocking absorption of substances that aren't useful in the body. And this is where most of the nutrient absorption occurs, such as fat, protein, and starches that can pass through and become assimilated. In addition, the small intestine functions to keep bacteria out, foreign substances, and large digested or maybe not well digested molecules, which is why it's referred to as the barrier. The cells of the intestinal barrier form tight junctions, which are designed to not only allow large molecules to pass through, but it also consists of a brush border, which are just the layer of cells designed to allow the right nutrients and molecules to pass through. Therefore, the intestinal barrier wears 2 hats. So if anything you're getting out of this, your intestinal barrier wears 2 hats. This is protection and nourishment. So remember those 2 words. Both of these, when they become disrupted, can have really serious implications in your health. For example, some foods we eat or medications or toxins can irritate the intestinal wall, and we lose our ability to discern between nutrients and foreign substances. And when this occurs, we have something known as intestinal permeability, also known as leaky gut. Now, the small intestine does have 3 parts. Scientifically, these 3 parts are duodenum, jejunum, and ileum. And each of these function to absorb different vitamins and minerals. Let me give you an example. The duodenum has an acidic environment, and it allows for the absorption of minerals, fat, and water, and soluble vitamins to become absorbed. But people with low stomach acid become deficient in one or more of these nutrients because they need the acid for absorption. Again, like I said earlier, there are these small finger-like projections called villi, which nutrients absorb, even the smaller projections called microvilli. The barrier between the body and the luminal environment is formed by the mucosa, these buffering nutrients, microorganisms, and toxins. And it is semi-permeable, so that it doesn't allow efficient transport of nutrients across, but excludes harmful molecules and organisms. And this is, these properties of the gastric and intestinal mucosa are referred to as the gastrointestinal blood barrier. So when we talk about this intestinal barrier in this beautiful image here, we mostly refer to the small intestine. However, the mucosal layer can refer to a broader category that includes the mouth, it can include the stomach, the intestines, colon, and even the bladder. and the vagina. But when we refer to leaky gut, normally that's referring to the small intestine. So this is where all the magic happens. That's why so much focus on the small intestine. It has three protective barriers. It has a physical, a biochemical, and an immunological barrier, which I said earlier. Let's put this into perspective. As a physical barrier, the lining consists of cells, as you can see here. And this allows nutrients to come in, but also controls the entrance or controls the abundance of bacteria through expression of antimicrobial proteins. Here's the thing. The gut consists of commensal bacteria, and this is a physical barrier too that promote resistance to colonization of pathogenic bacteria species, but by competing for nutrients and occupying these sites and releasing these antimicrobial substances. This is really important because a lot of people with this condition are not expressing balanced bacteria. They don't have the balance of bacteria and they're therefore lacking these very important functions in your immune system. But then there's this other component that regulates the immune system I talked about earlier, and this is SIGA, secretory IgA. And it is the most abundant immunoglobulin in the body, and it resides primarily in your intestinal mucosal surface. Now, I want to tell you, every lab that I viewed of people with IC and bladder pain are generally low in SIGA, secretory IgA, although every once in a while I run into someone who's high, which tells me that they're in the acute phase and not the chronic phase. And normally when people get in to me, they're already in the chronic phase, and this level of secretory IgA is really low. So let's go back to leaky gut. What does it actually mean? I think everyone uses it as it now. So do we really know what it means? It's really just a nickname for the term intestinal permeability, which is associated with many illnesses. Again, like I said earlier, your gut is lined with this barrier here, and this is the epithelial layer, and it's a single layer of cells that constitutes the largest and most important barrier against the external environment, as you can see in this image. It protects you from the external world, right? Microbes, chemicals, toxins, we talked about this. But it also consists of the commensal bacteria or the probiotic bacteria that also interact to help protect your gut. Now, here's where you need to know. In between these cells, there's these tight junctions. You see, this is a healthy cell on the left. You see how these are tight junctions? They're basically not allowing anything in, really, if you look at the picture. Well, when this plate area gets irritated or inflamed, like you see on the right side, they loosen up and they allow larger molecules to pass through. And when these substances pass through, our immune system, they basically respond as though it's a foreign substance and stimulates antibody response from your immune system, which also simulates inflammation. This means that things like bacteria and fungus and other toxic molecules, as well as undigested molecules, can pass through this weakened cell membrane and go directly into the bloodstream and activate an antibody alarm system and chemical messengers known as cytokines. So what happens? Well, the immune system is basically attacking. And this results in those inflammatory cytokines, which I just said were chemical messengers of your immune system, oxidative stress, free radicals, inflammation, and micronutrient deficiencies. So back to secretory IgA, I talk a lot about this, and I want you to understand why this is important. It's an important component of your gut immunity. And I also found it really interesting to be low in most people with bladder pain syndrome. Well, why is that? Well, let's talk about what it is. It is the most important immunoglobulin in the body. It's the first line of defense, and it promotes the clearance of antigens and pathogenic organisms. It regulates your inflammation and your immune response and can promote oral tolerance of food antigens, which means that people who have healthy amounts of this immunoglobulin are not going to have so many food allergies and intolerance. People who are low tend to be those people who can't eat a lot of foods. They can eat only a handful of foods because they have so many intolerances. And that can go back to that leaky gut syndrome. The job of this secretory IgA is to quench bacterial virulence factors and promote the transport of these antigens across and out. So it does this by forming these immune complexes when they're challenged by foreign molecules, and it can help downregulate the inflammation, the pro-inflammatory response, which is associated when the antigens are uptaken. So this secretory IgA can really help combat microbial infections. Now, Oftentimes, secretory IgA can be suppressed under high stress, high cortisol. So if you're more of a stressed environment or you're a very stressed out person, it can actually deplete this. And it can be elevated those who have acute infections, which I have seen every once in a while. Here's what you really need to know from all this. Take home point here. Chronic infections and stress will shut down secretory IgA, and you will find your body essentially giving up the battle. And I see this time and time again on various diagnostic stool tests like the GI map, where I see low secretory IgA, and that was me as well. So what causes gut dysfunction? And does everyone who has gut dysfunction have digestive symptoms? Well, the simple answer to this is no. Oftentimes, symptoms appear to be unrelated to gut dysfunction, when in reality, there's a silent problem brewing and waiting for the straw to break the camel's back, essentially. This is due to hidden stressors that break down your microvilli and other layers of your gut, which compromise your immune system. Now, while this is happening, you can have no symptoms at all, or you can have very mild symptoms like I did in my 20s. I had hormonal problems, and looking back now, I realize I probably had some digestive issues that I probably didn't really pay much attention to. But malfunction continues and imbalances cascade and other malfunctions can occur. Some of the triggers to digestive dysfunction and leaky gut include poor dietary choices and food sensitivities, toxic exposure like xenobiotics and pesticides, infections. They contribute a variety of ways, but generally they can promote cell damage and disrupt this delicate integrity. Various medications, stress and emotions, low stomach acid, dysbiosis, imbalanced bacteria, genetic predispositions, gut barrier and inflammation, antibiotics, proton pump inhibitor medications, endotoxins from bacteria, and mostly from bacteria, poor diet, and poor valve function. There's a term all of you listening should really learn and understand. This is called dysbiosis. It simply means imbalanced bacteria. Generally, this term refers to the gut, but recently it's been used to refer to anywhere in the body there's a community of commensal bacteria, such as your mouth, which can lead to problems like gingivitis, or your bladder, which can lead to chronic UTIs and IC, or your skin, which can lead to many common skin ailments. But here are some of the symptoms of dysbiosis, which many people who come to me have these symptoms. And there's a theory if your gut is leaky, so are other organs that consist of the tight junctions, and that includes your skin, your brain, and even your bladder. In this image, you can see how this can occur and what some of the effects of it are. As you can see, over time, this can lead to biofilms and chronic low-grade infections that are often associated with IC and bladder pain syndrome. And this can, in many people, lead to biofilms, which form in the bladder lining, which can be a very complex process to treat. Now, here's the thing. Many of these bacteria are really toxic to the bladder lining. Then many have a metabolites like ammonia, and they can really destroy the delicate tissue of the bladder lining, which is why sometimes when you do cystoscopy, they can see that the bladder lining is inflamed. Now, what makes matters even worse is this inflammation can disrupt the immune system and can lead to loss of oral tolerance, which means even more inflammation. These include things like IL-6 and NF-kappa beta, for example. And the leaky gut can allow food to translocate into the gut and create even more systemic inflammation and pain. Now, there are even groups on Facebook that discuss only the biofilm and infection theory of IC, and they often call it the embedded infection cause of IC. I think that's what they call the embedded infection. I want to point out this is highly oversimplified. It's really never that simple because the bladder is not naturally hosted by pathogens that cause infections. Infections occur due to imbalanced immune response. And as I progress through this presentation, you'll find that holds to be very true. Another interesting feature common among IC folks is an impaired migrating motor complex and vagal tone. What's that? Well, the MMC, which is the migrating motor complex, is responsible for sweeping things from your small intestine and keeping things moving. And when it's impaired, it can cause some of the problems you see that I've circled here. And this can lead to things like SIBO, which is small intestinal bacterial overgrowth, or impaired vagus nerve. And this can also be associated with thyroid dysfunction, trauma, adrenal dysfunction, neurotransmitter imbalances, IBS, and autonomic dysfunction. Another thing to consider is the role of food sensitivities. As this image demonstrates, food has a huge impact on your inflammation. Trigger mechanisms include food antigens, chemicals, and immune complexes, proteins that can activate cells of your immune system to release mediators, such as those crazy inflammatory cytokines, but also histamines. That probably rings a bell for a lot of you listening. Now, these can all promote symptoms that we're familiar with, such as inflammation, pain, receptor activation, smooth muscle contraction, excess mucus, neurological, endocrine, increased gut permeability, which is that leaky gut. So take a look at some of these other conditions on this page. Do these look familiar? Well, many people with IC also are inflicted with some of these other conditions as well, which kind of goes back to that theory that they're all interrelated. So within the food intolerance category, there's the role of oxalates. I don't want to get too much into this for this presentation because it's beyond the scope of this, but I want to introduce the concept to you. In a nutshell, oxalates, also known as oxalic acid, are anti-nutrients in plants. Plants use oxalate for structure, think of it like bones for plants, and protection to deter insects from eating them. They're naturally occurring, but they also are considered anti-nutrients because they can bind to your minerals, calcium, magnesium, zinc, and iron, for example, in the gut to prevent their absorption. In fact, oxalates are very potent mineral chelators and have a strong affinity for positively charged minerals, and those are the calcium, magnesium, zinc, and iron I just mentioned. And that's because oxalic acid is a negatively charged particle. They can bind tightly to heavy metals as mercury, like mercury and lead, and that can cause a lot of harm as well. Now, in the case of leaky gut, this can mean that the formation of oxalate crystals, also known as calcium oxalate, can deposit in various tissues, causing tremendous pain. And this can happen in any tissue and cause lots of problems. So where do oxalates come from? Well, there are three main sources. There's plant foods, has the highest concentration, is found in spinach, beets, Swiss chard, sweet potatoes, turmeric, and nuts. Microbes, mold and yeast can produce oxalate directly and indirectly. And then there's endogenous metabolism, which is the body actually producing oxalates during normal cellular metabolism. Here's what you really need to know. Oxalates are a poison. They can destroy your mitochondria, which you actually need to produce energy. Your cells need energy. Your tissues and organs are made of cells. So if you don't have energy in the form of ATP, your organs systems will eventually fail. Second, oxalate can alter redox homeostasis by depleting your intracellular antioxidants, such as glutathione and superoxide dismutase. Excessive superoxides or free radicals can then trigger mast cell activation. And if you have mast cell issues, histamine intolerance, or even chronic inflammation and allergies, you may just be dealing with an oxalate issue. Oxalates can also mechanically shred surrounding tissue and drive further dysfunction. They have jagged edges and they can actually damage tissue physically. This is one mechanism that's thought to lead to damaged mitochondria. And oxalates can also hijack the sulfation system. It moves through your body in sulfate transporters and combines with sulfate receptor sites, displacing massive amounts of sulfate from the body dumped into the urine. This renders sulfate unavailable for very important functions in the body, and one of them is to sulfate your hormones like DHEA. This is often why we see many patients with hyperoxaluria, which is high elevated oxalates, and also low in their major sex hormones such as DHEA and estrogen. And finally, they can also deplete your minerals, wreaking havoc on your immune system. And they can activate the inflammasome, creating a lot of inflammation in your body. So you can see oxalates are very, very detrimental to the body and one of the major associations with bladder pain syndrome. And finally, we cannot neglect the HPA, hypothalamus pituitary adrenal axis dysfunction, also known as metabolic chaos. It is your hypothalamus in your brain and your pituitary and adrenal axis that can also affect all these other functions in this chart. And I circled the ones that I see to be the most common with people with IC and bladder pain syndrome. Having imbalanced adrenal function can really throw a ton of things off and contribute to many of the symptoms associated with IC. As you can see, the root cause of IC resembles a stream in a lot of ways. You have upstream influences like genetics and toxic exposure and trauma that can lead to midstream mechanisms such as gut imbalances, food imbalances, and nutrient imbalances that then lead to downstream symptoms such as immune dysfunction, infection, and inflammation. These are often expressed in things such as Lyme, co-infections, UTIs, biofilms, gut infections, parasites, inflammation, and reduced immunity. It truly is the perfect storm. Now, this image is coming from the free course I'm providing for all the participants of this presentation, and I think you're going to find it pretty enlightening. Now, something that everyone listening here really needs to wrap their head around is that it's very difficult for people to hear, but this is the nature of trying to promote your body's own healing powers. Healing is a multi-pronged approach. There's no magic bullet when it comes to healing IC and bladder pain syndrome, or any chronic condition for that matter. It requires many different elements, and not all of them are in my wheelhouse. So I often have to make referrals. These include addressing structural abnormalities, like seeing a chiropractor or a physical therapist, stress management, PEMF, sauna therapy, acupuncture, ozone, and then nutrition and biochemistry, diet and exercise and detoxification, which are more part of my wheelhouse. But the point is, it does take attacking multiple angles to really initiate the body's healing response, and there's no single path to healing. One thing we know for sure at IC Healer, your mental state will define your outcome. If things can get worse, they can also get better. It all starts with your mindset and determination and compliance and of course, giving your body time, self-love, forgiveness, and having gratitude, areas that we often neglect. And of course, taking the time to identify your root cause. It really all does come together when you put all the pieces together. And here's the thing. We have been educated in the Western society that the focus should be on treating disease, that every disease has a unique treatment and a pill for every disease. That concept grew out of the era of infections and antibiotics. However, most disease or injury is not that simple. We need to correct the functions of the body that became disordered and resulted in the disease or injury, and to support the body's own ability to heal itself. Every cell in the body is intelligent, per the book by Dr. Bruce Lipton, The Biology of Belief. I recommend that everyone listening who's interested in healing their body get a copy of this book. Every cell knows exactly what to do to make itself healthy and functional, but they do their best and still come up short, needing exact energy to do their job. Supporting the body's own natural healing capacity is paramount to achieving good or optimal health and recovering from many health problems. So finally, what can I do to help you? Well, here is a screenshot of some of the tests I like to do for my program. What I love about specializing in this is I can really start to see patterns that are common. And I love tying in the biochemical pathways among the different labs and correlating them to the client's symptoms. I've narrowed it down to 3 tests: full functional blood chemistry and urinalysis, hair tissue mineral analysis, and the organic acid test. At times, a mycotoxin test when mold is suspected, a food sensitivity test to help with diet mapping, and sometimes a stool test if there are parasites or infections suspected. And those are just special circumstances. Generally, we do these 3 tests and they give us plenty of information. I also want to mention up here, I've also seen a lot of people come to me after having worked with functional medicine doctors who run fancy labs, including Lyme tests and labs I've never even seen before. And I just don't know if they're necessary at first. I honestly think that doing these 3 are really going to hit the foundations. And then later on, after you've done some healing, you can open the door to these other fancy tests. But really, I truly believe that these 3 are the ones that really hit the main problems, and people can get significant improvement when they address some of the imbalances that are found from these 3. So at IC Healer, we believe there are 7 basic steps to reverse IC and bladder pain syndrome. And these include 1, find your root cause and imbalances. 2, heal your gut and quench your inflammation. 3, optimize your diet. 4, tame the toxins. 5, heal your infections. 6, reset the nervous system. And 7, manage your stress. So our clinic will discover your root cause and guide you on your healing journey. I also need to mention that healing is not linear. It's actually a journey. That's why it's called the healing journey. And it's never that linear path that everyone thinks or expects it to be. Wouldn't that be nice if it was? It's really an up and down process, and one that consists of good days and also bad days. The timeline depends on many factors. See, listen, illness is rarely, if ever, an instantaneous occurrence, and the same goes with healing. The level of pathology of the disease state is really important to consider. What I mean is the deeper and longer the pathological process has been present, the longer it will take to recover. And here's the thing, there's typically multiple tissues of the body are involved, and everyone has their own healing timeline, and those tissues all have different healing timelines. So this does kind of complicate the healing process, but what I'm trying to get to is it requires diligence and patience on the patient's part. So you've got to be patient with the process. That's really what I'm trying to say. And now for your free gift. You all get access to my free mini course that discusses how the root cause of IC and bladder pain syndrome resembles a stream. Now, there are upstream, midstream, and downstream influences, and you will learn about them in this short little course. Simply visit the page ichealer.com/mini course and enter your email, and you'll be entered into the course, which will consist of a series of videos that will be emailed directly to you. Thank you so much for attending this presentation. It's been an honor to present this information today, and I hope you've gained some insight as to some of the root causes of IC and bladder pain syndrome. I truly hope that this presentation has given you some hope on this illness, that it's not a death sentence, and that in reality, it is caused by multiple imbalances in your body. Here's where you can find me on ichealer.com, and here's my Instagram handle, Dr. Mandy DCN. YouTube is IC Healer. Facebook is IC Healer. And then I have a private VIP Facebook group that we do require people to be in my email list to enter this particular VIP group. And you can also email me at mandy@ichealer.com.